A urinary tract infection, or UTI, occurs when bacteria enter parts of the urinary tract, usually the bladder or urethra. UTIs are extremely common, especially among women, with over half of all women experiencing at least one UTI during their lifetime. While antibiotics are the primary treatment, there are certain dietary changes you can make that may help prevent or manage UTIs. Some of the most common ways people get UTIs include from improper bathroom hygiene, infrequent urination, dehydration, sexual intercourse, using diaphragms or spermicides, or a blockage that prevents the bladder from fully emptying. Women are more prone to UTIs partly due to shorter urethras that allow bacteria quicker access to the bladder. The most frequent UTI symptoms are a burning sensation while urinating, an intense urge to urinate despite little coming out when you go, cloudy, bloody, or foul-smelling urine, pelvic pain or back pain, and possibly fever and chills if the infection spreads to the kidneys. While not a substitute for medical treatment, adjusting your diet can help give your immune system an assist in fighting infection or deterring the bacteria that causes UTIs in the first place. Here are the top 10 foods to avoid if you have UTI. Number 1. Alcohol. Alcohol impacts kidney health and urinary tract function in a few ways. First, alcohol can dehydrate the body, which concentrates your urine. This allows bacteria to multiply more easily and irritate the delicate urinary tract lining. Alcohol also prevents the kidneys from properly filtering waste from the bloodstream, again allowing more bacteria to grow. And as a nervous system depressant, alcohol slows the transmission of signals from the bladder to the brain, which reduces your urge to urinate. Infrequent peeing allows more bacteria accumulation. Moderate your alcohol intake, stay hydrated with water between drinks, and use the bathroom as soon as you feel the need to avoid irritation of the urinary tract. 2. Caffeinated beverages. Like alcohol, caffeinated drinks like coffee, tea, soda, and energy drinks have a mild diuretic effect, which increases urine output. This leads to the need to urinate more frequently. However, caffeine also contains certain compounds that can irritate the bladder wall, exacerbating UTI symptoms if already present. Caffeine may also alter kidney function, preventing proper waste filtering. Minimize intake of caffeinated beverages when experiencing a UTI, or consider decaf alternatives to avoid bladder irritation while staying hydrated. Number 3. Refined carbs. Foods made with white, refined grains like white bread, pizza dough, pasta, pastries, and other baked goods may negatively impact UTIs. Refining grains removes the nutritious bran and germ, leaving only the fast-absorbing starch behind. This surge in blood sugar causes inflammatory reactions in the body, potentially irritating the bladder wall lining. Refined grains also feed bad gut bacteria associated with UTIs. Limit refined carbs, opting for whole grain varieties higher in fiber instead. The complex carbs in fiber regulate digestion and provide good bacteria colonies that protect against infection. 4. Artificial sweeteners. Sugar substitutes like aspartame, sucralose, and saccharin are commonly found in diet soda, juice, desserts, candy, gum, and other processed light products. Although zero-calorie, these synthetic compounds can have a deleterious effect within your digestive system. Artificial sweeteners potentially reduce healthy gut bacteria diversity, allowing the E. coli strain responsible for 90% of acute UTIs to dominate instead. Additionally, research indicates that saccharin may irritate the lining of the bladder and urethra by obstructing cell receptor sites and preventing the cells from adequately adhering to each other. Avoid artificial sweeteners when trying to treat or prevent painful UTIs. 5. Spicy foods. Hot peppers, salsa, buffalo wings, and other fiery foods can worsen already inflamed urinary tract tissues when experiencing a UTI. The compound capsaicin gives chili peppers their intense heat by boosting blood circulation. This leads to swollen, irritated bodily tissues. Avoiding spicy cuisine when showing early UTI symptoms may help ease painful urination and pelvic pressure. However, capsaicin also exhibits anti-inflammatory properties, so spicy foods in moderation may help resolve UTIs when infection is advanced. Just beware the initial sting and discomfort spicy dishes may cause upon an existing UTI. 6. Aged and processed meats. Pepperoni, salami, hot dogs, sausages, bacon, deli meats, and other cured and processed animal proteins frequently contain nitrates and nitrites. These chemical preservatives give meats their tempting pink color and smoked flavors. However, within the body, nitrates and nitrites convert into bladder irritants like nitrosamines. These compounds are linked with chronic UTIs by damaging the inner protective lining that prevents bacterial adhesion. Processed meats also harbor higher counts of E. coli due to manufacturing contamination. Choose uncured organic meats like chicken, grass-fed beef, or wild salmon to avoid exposure to bladder-aggravating compounds. Number 7. Fizzy drinks. Carbonation gives soft drinks their bubbly personality, but this sparkling effect can boost bladder pressure and discomfort when suffering from a UTI. The release of CO2 gas creates acidic urine as the kidneys filter out the excess carbonic acid. Acidic urine allows certain aggressive bacteria strains to thrive, worsening an infection. The phosphoric acid commonly added to colas also irritates the bladder lining. Swap your soda for soothing herbal teas, water with fruit slices, or plain mineral water with a squirt of citrus for flavor when combating a UTI. The potassium in coconut water or aloe vera juice may also offset the kidney function disruption that leads to bacteria proliferation in urine. Number 8. Dairy products. Milk, cheese, yogurt, butter, and other dairy foods are loaded with calcium and vitamin D, but the high lactose content can be problematic for those prone to UTIs. Most people lose the ability to properly digest lactose, the sugar found in mammalian milk, past early childhood. Undigested lactose ferments in the intestines, producing hydrogen gas that may produce irritation of the urinary tract. Lactose also feeds undesirable gut microbes, lowering the overall microbial diversity believed to protect against pathogens. Temporary avoidance of dairy while treating a UTI can help relieve GI upset and excessive gas production. After symptoms resolve, probiotic supplements may help you tolerate dairy again by normalizing intestinal bacteria vital for proper digestion. Number 9. Fried and greasy foods. Onion rings, French fries, donuts, fried chicken, chips, buttery baked goods, and other fatty cuisine may satisfy cravings but contribute to UTI recurrence and severity. High-fat foods require more digestion bile salts to fully break down for nutrient absorption in the small intestine. However, excessive bile secretions make urine more alkaline, which allows certain bacteria strains to rapidly multiply. Dietary fats also release inflammatory signaling molecules that can irritate tissues. When battling infection, stick to lighter baked, grilled, steamed, and sautéed options using minimal cooking oils. The antioxidants in extra virgin olive oil may actually inhibit UTI pathogens without the greasiness that stimulates bile overflow. 10. Frozen desserts. Creamy ice cream may beat the summer heat, but the high sugar content serves as excellent fuel for infection-causing bacteria. In fact, E. coli's ability to cling to the bladder wall is enhanced in the presence of glucose, allowing it to evade being flushed out. The milk fat and dairy proteins in ice cream, gelato, and frozen yogurt also place extra strain on digestion, similar to other dairy products. And certain probiotic frozen desserts actually contain UTI-associated bacteria strains as active cultures. For symptom relief, avoid all frozen confections until UTI treatment is complete. Focus on cooling foods like chilled soups, smoothies, and hydrating fruits and veggies instead. Adjusting your diet is just one aspect of resolving a stubborn UTI, but the right nutritional choices can lessen discomfort and support immune defenses. Pay attention to foods that aggravate pelvic pain and abdominal cramping, like spicy, acidic, or gassy items. Stay hydrated with plain water, herbal teas, aloe juice, or coconut water. Avoid diuretics like caffeine or alcohol that stimulate frequent painful urination. Fill up on nutritious, antioxidant-rich items like fruits, veggies, legumes, whole grains, and lean proteins. After finishing any prescribed antibiotics, continue avoiding inflammatory foods that may compromise kidney or bladder health. Instead, emphasize cuisine containing probiotics, prebiotics, and antimicrobial plant compounds to restore protective bacteria colonies. Some foods fitting this criteria include kefir, miso soup, bananas, garlic, onions, leeks, and green tea. Consider taking a high-quality probiotic supplement as well while recovering from recurrent infections. Always confirm lingering UTI symptoms with your physician instead of self-diagnosing based on dietary causes alone. Blood in urine, back pain, and fever require immediate medical care and analysis to rule out a kidney infection or obstruction. Only a urine culture can identify the particular infectious bacteria strain in order to fine-tune antibiotic selection. Work closely with your doctor until infection markers fully clear. In the meantime, pay attention to subtle signs your diet affects UTI symptoms. Keep a food journal tracking all meals, drinks, and supplements along with any pain, urgency, or other discomfort over the following days. Over time, you may spot behavioral connections that worsen or relieve discomfort, so you can tailor your menu accordingly. Customize your diet to reduce UTIs without unnecessary food restrictions impacting nutrition. Regaining confidence with your favorite foods free of infection fears is the ultimate goal. We covered a lot of ground looking at foods potentially aggravating urinary tract infections today. Let's review some of the key takeaways when modifying your diet to help resolve acute UTI symptoms or avoid recurrence long-term. Stay hydrated with water, herbal tea, diluted fruit juice, and electrolyte sources like coconut water. Reduce diuretic caffeine and alcohol that force frequent, painful urination during infection. 1. Choose lean proteins like skinless poultry, fish, eggs, legumes, and tofu over fatty, processed red meats whenever possible. Avoid nitrates, nitrites that convert to bladder irritants. 2. Emphasize fruits and vegetables over refined carbs and sugary treats. The natural sugars and carbohydrates in produce provide nutrients without rapidly spiking blood glucose. 3. Limit dairy, fried fare, spicy items, and carbonated drinks temporarily when actively fighting infection. These foods can worsen swelling, irritation, cramping, and leaky gut. 4. Discuss probiotic and antimicrobial supplements with your doctor that help restore protective bacteria colonies after antibiotics disrupt digestion. Garlic, golden seal, oregano oil, and caprylic acid target UTI pathogens. As always, clear any dietary changes with your physician first since nutrition needs are highly individualized. What triggers painful flares for you may not affect someone else the same. Finding your personal UTI triggers and safer alternatives empowers you to manage symptoms long-term through the foods you eat daily. Implementing just a couple positive changes may tip your gut bacteria back into balance, resolve chronic inflammation, and allow your body to effectively combat painful UTIs again. Pay attention to input and output correlations guided by a food journal. In time, you will instinctively learn how to eat in harmony with your body, rather than strictly following rigid, restrictive diets that inevitably backfire. Stay tuned for more videos focused on overcoming frustrating urinary tract infection recurrences through natural lifestyle adjustments like nutrition. Managing UTIs requires patience and diligence, assessing multiple variables that contribute to your risk profile. By addressing all dimensions including stress, exercise, hydration, hygiene, and now diet, you can deduction which factors worsen or alleviate your discomfort. Put all the puzzle pieces together to minimize infections for the long run. Thanks for watching, and we'll see you in the next video.